Welcome to Par Lettres, a long-form podcast hosted by Nishi Pandit and Andrew Flores, where we explore the work of Jacques Lacan through free associative conversation. Par Lettres exists as an invocation and enactment of analytic discourse, where we speak from the locus of our own desire and engagement with Lacan's oeuvre. We invite you to hear Lacan through the conversation of speaking beings, whether you are philosopher, student, clinician, or simply curious about what psychoanalysis has to offer to the cipher of our mortal destiny.
All right. Welcome back, everybody, to the Par Lettres podcast. This is the first time I'm introducing us. It is the co-host, the Big Signorelli, aka the Big Sig, also known as Andrew, with my fellow colleague and co-host and friend, Nishi Pandit. And we have a special friend and guest on the show, Michael
I don't know about
McAndrew.
special, but thank you.
Yeah.
Yes, welcome, Michael.
Special with the big S.
Yeah, the
A
big S, the big S and the big Bard S.
Friend and fan of the show, Michael
Sorry.
McAndrew, who's located out of Denver, Colorado. He's a practicing clinician, both in Lacanian and outside of the Lacanian orientation. We could just say like you're an analyst as extension because you've pretty much been in many institutions, have a lot of experience. And we've been planning this conversation for quite some time, but I think what we've agreed upon was to focus on an event that recently just passed that we, Michael and myself, have participated in, and my girlfriend Eleanor. It's called the Clinical Study Days, which is a part of the U.S. vector called the Lacanian Compass, which is an extension of the NLS, which is also associated with the World Association of Psychoanalysis, which the big wig is Miller and many others. But Michael, you could fill in the details because I'm not as good on the big politics of the institutions.
I don't need to get bogged down in all this.
But the point being is this conversation is going to revolve around the theme of ordinary psychosis, which is a big concept and highly debated concept. That's not even a concept per se. As Miller says in this Ordinary Psychosis Revisited, it's like an epistemological problem for the clinic, as much as it really is a diagnosis. It's more of a question regarding diagnosis. And it's to pretty much avoid falling into this either or. Oh, you're not neurotic, then you must be psychotic. Oh, if you're not psychotic, then you must be neurotic. And I think this is like some of the problems that I think during his time, and even you could say currently with other um, Lacanian schools that don't follow like the clinic of the real, focus on jouissance of the body, etc., that they fall in this dichotomy of like, it must be psychosis, which psychosis in them is always extraordinary, which means paranoia, extreme delusions, megalomania, erotomania, etc., or it's neurotic, you're just an obsessional. And to tie it into the Clinical Study Days, the theme was misunderstanding sexuality and its relationship to a lot of the cases which were either extraordinary psychosis or ordinary psychosis. I don't know if you have anything to say, Michael or Niche, but that's my spiel.
Nothing other than to say I think we see a lot more psychotics than we think today. I'd be very curious to hear what you have to say about that, Nishi. It's my experience, not just in an institutional work, but in private practice.
Yeah, I absolutely agree. And I think that's something that struck me as being very on point in Miller's lecture on ordinary psychosis. I felt that with the introduction of this like ordinary epistemology, that he was actually getting at something in the realm of commonality. And also, he also spoke about kind of what I would call latency, like latent psychosis. And I do think we see a lot of latency in people's illness today. I see that in my clinic as a whole. As people know, I also do medical work, acupuncture and Asian medicine and such. And this was one of my areas of interest, actually, was trying to understand more about these hidden illnesses, which often manifest in autoimmunity. They often manifest in like hidden pathogens, yin pathogens, what we call. And they usually manifest also with symptoms that we would call psychoanalytically psychosis, hallucination and so forth. And that's on a spectrum, I think, of ordinary to extraordinary. And that's something I actually really like, that Miller is giving us a way of looking at psychosis on a spectrum of ordinary to extraordinary. You know, that psychosis isn't just these extreme cases of schizophrenia, paranoiacs, etc. You actually have people who seem to be living everyday lives more or less, almost mistakable for a neurotic. And they're having this kind of ordinary psychosis, and he also connects it to this kind of core existential level of the being. And I really resonate with that as well, because I think in some sense we are all mad, we are all delusional. And I think he's really getting at something with this universalization of psychosis. As a way of thinking, I'm really on board with it.
Just one thing I wanted to add when he says about like how we're all a bit mad, and he says that there's something like of a shared delusion. He's like, God forbid I talk about Muhammad in the ordinary psychosis essay, but he's saying that like, you know, Muhammad had a vision, then he went home, and that changed civilization for, you know, many years to come to the present, where there is this shared collective belief of the Prophet Muhammad and of Allah. And this is not to, bash religion. We're not talking about. The point is that he's saying that pretty much belief, um, or something of a core understanding or meaning can shape a civilization. And this is something that Freud has talked about in Civilization as Discontent, not just with religion, but even you could say, the norms and ideals of science and modernity. And I like what Lacan says as early as Seminar 3. So it's like he's already thinking about delusion and like ordinary psychosis to an extent, about how like this idea of the discourse of freedom, when you boil down to it, like freedom and the way it's practiced is everything but the opposite of freedom. And it's actually a sort of individual myth that we hold on to. And when we can't actuate it or fulfill it, we end up in this sort of impasse where we could either break down in madness, or we could have a sort of neurotic signifier to kind of plug in that gap. But I think this is what he's like saying, like even Lacan himself in his teaching, he says, don't understand me. The point is to understand how even Lacan's teaching has a form of delusion. We got to
Mm-hmm.
understand Lacan's way of understanding, but
Mm-hmm.
not try to understand the message itself, like boil down to the core of like, what is it exactly he's saying? It's like, no, like follow the thread.
I think this is a good question about the place of the psychotic, not just in society today, but in Lacan's day, historically, that there's not as much room, I think, for the psychotic experience, even though, again, I think we are seeing more. I don't think we're seeing more psychotics. I think we're identifying more people as possibly psychotic, but there's not as much room for this. Maybe in politics, but outside of that, I'm not sure.
Well, I wonder, like from your experience, like maybe it's not like sort of grandiose, like paranoia, or erotomania or delusion, but we could say like, for lack of a better term, you know, mental breakdowns, having moments of madness where it's just like your whole world collapse, and you see many people kind of use drugs or other means to kind of cope with that, but then you know their world sort of collapses and they end up institutionalized, or they end up on the streets. Uh,
Well, I mean, I think they can still find places. We would see like a paranoiac. Lacan says in first writings that there's still very much a place for the paranoiac, maybe at the head of an organization,
mhm,
maybe a nonprofit, theoretically, he
yeah.
says, not at all having experience in that.
Mhm. Yeah. Well, it's interesting also to think that, hearing you say that, what Miller says in the essay as well, is like, this person, Mr. Twist, is the sort of pseudonym for this ordinary psychotic. Or no, it's like sort of extraordinary, but in some ways it kind of puts into question the ordinary aspect of his psychic life. And he was not in Analysis, it was his wife. And I like this point that Miller says, it's like whenever a wife talks about their husband or complains about their husband, it's always objective knowledge.
That's for sure. That is for sure.
But he says that unlike the sort of Schreberian psychosis, where like he's almost forever in an institution until like he has to give a testimony to say that he's fit to live in civilian life, it's like as if the fear of being institutionalized and losing his job snaps him out of it, and he's able to go back to work, be a husband, be a father to a certain degree. But it's like there's something about not necessarily just an identification with the job, but the loss of the job, right? Like, even though there's like, a sense of maybe paranoia, a sense of delusion to him, or something extraordinary, that it's not enough to get him lost in the whole of the real, to use Lacanian jargon. In fact, something symbolically about loss comes in to snap him back into quote unquote reality. I want your thoughts if like you see that in your work as well, with ordinary psychosis.
It raises a good question because we don't really have institutions the same way anymore today. You can be maybe placed on a 72-hour hold, maybe, in a really extreme case. If you live in certain states, if there's funding in a bed, maybe you can have a hospitalization. But there's not this Schreberian experience where you're going to go into the hospital, and if you get better, you can come out. Probably not, though. This is where Lacan did his psychiatric residency, his training, is these kind of places where it was just, all right, you're going to go in and maybe you'll come out one day, but probably not. And, I have a lot of colleagues who might say, well, institutions, these are bad things. These are run like, terribly. And I actually don't think I was alive when there were still psychiatric institutions in this country. And maybe they were run pretty badly, but the idea, I think, of a place for the psychotic is an interesting one. I'm not entirely sure Schreber would be institutionalized today. I think Schreber would just be a person here out on the street being a judge. Not even on the street, probably be a pretty good judge. Um, but there could be a place for somebody that might be useful to reconstruct themselves, to build something up, to be stabilized.
It's funny you say that because, like, I think it was in Freud's case on Schreber when he's talking about his last stay in one of the sanitariums, how one of the, I think, I don't know if it was a nurse or like one of the sort of like lower level the doctors uh thought that he was like, he couldn't believe that this man was like an inpatient because of just how he had like this like really intellectual demeanor to him. He was able to talk about current political affairs and how he thinks like President Germany should be ran versus how it's ran now, and even how to give advice regarding business exchanges to all the other patients that were like a former businessman, and even the ins and out of the institution itself, how he thinks that's like, there's a fault in the institution and the bureaucracy of it and it could be ran better. And so it's kind of funny to think that like, Schreber is this person who's got these like God delusions, he's God's woman, etc. But then like outside of that, he's very good at like strategy, logistics, leadership, uh, business, and he's a judge, and he has reason. So it would be interesting to see like not even Schreber himself, but somebody that has the same characteristics. Where would they be? I guess that goes back like what is the position of the psychotic, their placehold in society?
Right. And I think that raises a very important question, which is one of culture. Like, for example, in the East, you have the idea of domains of existence that don't require a social link. In other words, the ashram, the sanctuary, the spiritual refuge where you literally are enabled and validated in the motive to renounce society, to renounce worldly modes of living, even like career, job, these things that Miller is pointing out, that can also be a psychotic solution, that because there is the foreclosure of the name of the father, then like excessive attachment to job and so forth as a reconstruction of that whole, is kind of what he's saying, a feature of ordinary psychosis. So you could see very functional people, but then you have this idea that maybe you don't need that social link. You don't have to make that construction. You actually make the ashram your reconstruction. You make spiritual life a reconstruction, a substitute that allows you to kind of maybe even enjoy or have your psychosis be something fruitful. And, you know, I think there is often a precipitating event that leads people to that. I mean, I can analyze myself in that case, you know. I was having spiritual experiences as a teenager. It led me to embrace intensive mode of spiritual life, you know. Why? Well, there's something of a psychosis in intensive spiritual experience that disconnects you from relatedness to the world, at least temporarily. And it does require like a construction of like a refuge in which you can reconstruct yourself to possibly have a social link again, you know, which I think was successful in my own case. Not that I'm psychotic, but that raises the other question of Miller saying that this whole thing, neurosis, psychosis, we're in this either or. And I would have to agree with him. Like more often than not, I see a neurotic and I, I, I always at least wonder if he's psychotic, you know, because there's often explicit psychotic features. Like, you know, in one of my cases, he's even had psychotic breaks, had to go to institutions to recover himself from these psychotic breaks. But today, I wouldn't describe him as a psychotic. I'd say he's like a textbook obsessional. So now what?
I'm also, even to add on to that too, like we don't even know until like there is that moment in one's period where there's a psychotic break. Like, I mean, Michael, you and I are both military. I don't know if you've experienced, or veterans. I don't know if you experienced this in your time, but like people that have been, you know, in for so long, they do 20 years and they're just fine. And as soon as they get out, then all of a sudden they have like a mental breakdown and like they just can't handle it anymore. They get hospitalized, or like, you know, they fall into like alcoholism. I'm also thinking even like what's going on right now with the famous MMA fighter BJ Penn, who's not well. Like he, you know, retired. He was a successful lightweight champion. Then he tried to run for governor of Hawaii. I don't know how that went, but then now he's having like these psychotic delusions and he's like threatening his family every day. So, you know, these are like, you know, juxtaposed examples of like how it could happen like late in one's period, definitely, like, you know, when they can't do the thing that they were so identified with, their job,
Mm.
you know, being this and that, having a place symbolically, I guess you could say.
Yeah, it's a question what lends some structure, be it the ashram, or I think of all these old stories of monks who spent like all day drawing one letter. That would be great for some psychotic people. That would be great in general, maybe to just draw one letter all day. But you know, like this thing something falls apart. A marriage dissolves. Somebody decides I'm going to quit drinking, and maybe those, you know, that after work beer down at the Elks Club was something really signifying. All kinds of things, but maybe to a larger cultural point that I think can bridge these things is there are not as many things to hold things together anymore. There's not as many religious experiences available unless one really seeks them. There's not as many experiences of community. I mean, we're talking about the place of the psychotic. Where's even the place for the neurotic?
Mm-hmm.
There's so little social bond that can exist today. People are so what do the communists say? Atomized. They're all no bond there. Yeah, it's a good point. Where do we go when, you know, you can just be on your phone all day and talk to nobody, work from home? There are people, there are probably many people, even just in, certainly in Colorado, definitely in California, who may not encounter a person all day. You wake up, you log on, you get Uber Eats, you go to the gym where there's nobody, you're on your Teams meetings, you do your check-in with your supervisor. You may have talked to nobody all day. You may live completely alone. And that's very alienating.
Exactly. And it's so funny to think about it, just kind of like a digression. Like, obviously, there's a consumer aspect to American capitalist society and its culture, but like, you know, I'm someone who is like on this cusp of millennial Gen Z. But, you know, I lived in this period where like the mall used to be a really great social activity, a social bond, even if it was a consumeristic activity. It was something that you looked forward to, like, oh my God, it's Friday. My friend's mom, who's the cool mom, is all going to pick us up after school and we're going to all hop in the van and she's going to drop us off. Here's $50, you know, go to the store and go watch a movie. And like we go sneak into a freaking rated R film in the mall and then like eat some ice cream, like buy something cool. That is like a social activity. Now you don't even see that anymore. You go to a mall, it's so dead. Everybody's shopping on Amazon, Etsy, you know, Cotton Up, etc. It's just immediately there. you're doing nothing.
There's a strange phenomenon I noticed here because I had to go to the mall for something last year, and I was like, "There's going to be nobody there. It's going to be an empty mall," and it was all people who were immigrants, children of immigrants, recent. And I was like, "Wow, this space has been reappropriated for social bond." I swear to you, the mall here is as crowded as one in the '90s. It's the strangest thing to see, but there are people there using it as a central locus. So I mean, again, it's a question of where there could be social bond too.
And that speaks to psychosis, one of the main, core characteristics of it, which is alienation. And that could be a culturally born, culturally shaped experience of alienation, but it also, I think, is building on an existential experience of alienation that's like prior to even experience, prior to any event. It's almost that experience of the mirror stage itself, being like a primordial alienation. I thought it was interesting the way Miller like retraced the imaginary component, in Lacan, and then he goes into this whole other thing. And I don't know, just all of a sudden that's making me think about the linkage between this ordinary psychosis idea. And he's saying that the three registers are loose, or a bit loose in a way. And then it made me wonder about the Santome as that fourth knot. And there's clearly some linkage here that I had made a note to myself, like I wanted to explore that. So anyway, it just came forward now.
You got something to say?
No, please go ahead. I'm still turning it.
We're throwing a lot out there. Maybe we could rewind and kind of go back. So when we started this project, it was first with the mirror stage, and then we went into function and field. And I think like it's important to note, not that he doesn't bring up psychosis and function and field, but we could, for better or for worse, generalize it as we're thinking about the neurotic subject, especially when we're thinking about speech and language. He has like a couple of gems where he says something like the analyst's job is to position themselves in a way where the speech and resonance of the patient is sort of brought to a halt, and it's to suspend all his certainties and judgments, to put him in logical time, for lack of a better term, and through moments of intervention and interpretation. This is for the neurotic subject whose unconscious is structured around repression. And so you have different ways of intervening and guiding the treatment to kind of bring that back to what we were talking about. What would the analyst position be for both the extraordinary and possibly the ordinary psychotic?
What do you think, Nishi? I want to hear what you have to say.
Don't you think that we function as object A? The object A is like the position of the analyst in the sense, and he was saying that they kind of are like unable to latch onto an object A, like the ordinary psychosis. He was saying something like that. That's his first thought that comes to my mind. We function as something that can help, tie together some threads, I think, it's like a mechanism for that in the subject. I think analysis functions that way through the transference in any case. I think it's also what makes psychoanalysis such a cutting edge approach to the treatment of psychosis, if we even want to call it a treatment. I don't think there's anything in medicine or any other field that is so on point with what psychosis is and how we can work with it clinically. And why is that? I think it's because we understand transference, and transference as the mechanism, the directionality, the process of the cure in a way. For the psychotic more than anyone, I think. Even though we also have that idea like, oh, you don't want them to lie on the couch pre-associate, it's kind of contraindicated, but I sort of think about that almost homeopathically. It's like what's contraindicated actually is like the very curative thing as well.
I have a joke I've been saying lately, but I think the joke gets to something correct here. Lacan gave us this really excellent treatment for psychotics that we keep wasting on neurotics.
I love that. I really love that.
I mean, a neurotic analysis, it works, it does certain things, but I feel like the analysis of a psychotic, like the effects become much clearer, let's say. Like we could be in analysis 10, 20 years and we say, well, this happened, it's very mysterious, maybe not. But with a psychotic, we can mark really discrete points, I think, in the treatment, because I think the transference is different with everybody, sure, depending on their object choice, depending on where they are at in their analysis, who knows. But I feel like with a psychotic, it's so much different because you're something. Lacan calls us the secretary of the unconscious. Sure, but there's lots of jobs one can do that aren't the secretary. The best friend, the confidant, the partner for play, a lot of different things. As a spiritual advisor, really, one could definitely be a spiritual advisor for a psychotic in analysis. Not in the sense of perhaps a true, pure spiritual advisor, but someone might spend quite a bit of time talking about religion in psychosis, and you're just sitting there saying, amen, absolutely.
And I think that says something about, like, even the theory of the discourse that's so important for Lacan, and like as he constructs it in the later years, because like I like that joke, like, Lacan created something for psychotics that we're wasting on neurotics, because I think at the end of the day, like, whether or not like a classical obsessional neurosis or even hysteria still exists, it's like at a certain point it almost becomes redundant and stereotypical. And for analysis and even the analyst itself, it's like they already have that knowledge, and so they already know what to do. But I think the point of analysis is to always invent something and to do something that relates to the real, that relates to that sort of chance encounter, that says, like, what is it? Like, it always poses the question of what are we doing in analysis? We should always return to that question. If we are certain about what analysis is, then we end up constructing a university discourse, right? We end up constructing a bureaucracy rather than the question of a school, right? And the way we not disseminate knowledge, but transmit and say, out of testimony that this was an analysis. And I think what you're saying, Michael, and then like what we witnessed at the clinical study days are examples of like psychotics being transformed in very unique ways that, it's something that you won't see in the DSM-5. It's something that you won't see in DBT or trauma-informed therapy or what is it? The eye rapid movement, EDMR,
EMDR.
EMDR. Yeah.
It might be better for EDM. It would sound better.
That was a funny slip.
It's, but I mean, ironically, and again, you both work at different levels of this thing called the mental health field. I'm finding more that medical people are more open to some ideas of psychosis and psychoanalysis, maybe more than, let's say, jest therapists who are really committed to some sort of a piece of the pie.
I think that's definitely true, Michael, because I think people who practice medicine of any kind do notice the limits of their clinical field when a psychotic approaches them. And they realize that it puts into question the efficacy of their modality, and even it raises a question of modality. Like, what do we do with this? We don't even fully understand it. And I think this is where Lacan has not only humanized psychosis, but he's brought forward an approach to understanding it that I think is actually non-pathologizing. Like, we can't really say that there's pathological dimensions to it, but fundamentally, when we look at it structurally, that's non-pathological. It's a question of structure. There's reasons for the structure. There's logic in that too. Everybody forms the way that they do in reaction to what they do. And it reminds me also of something my psychotic analyst said to me recently. He said, "I exist because I speak to you." And I thought, this is the kind of statement you get from the psychotic, these like unfiltered truths that are so actually beautiful, because they also illustrate exactly what Lacan says about the nature of discourse as something constituting, But it's for the psychotic to be able to say that also points to the fact that analysis is constructing a relation for him. And if I would reflect on his case, I would say the first time I spoke with him, he was absolutely unintelligible, really. Like, voices were coming through, like facial tics. Like, I didn't get the sense I was really speaking with someone yet, but I was just kind of with it, just witnessing, allowing that to kind of go on as a free association of a kind. And now I would say I feel more like I'm speaking with a neurotic, he's been neuroticized by analysis, and in a way that's actually positive. That's a direction of cure.
Yeah, again, these markable things. I think what you say about medicine is very interesting because the person in the medical the medical field,
Mm-hmm.
they can mark when something's working or not. I tried this treatment that my training shows me it's not working. Okay, let's
Mm-hmm.
try this one. It's better not working. Let's continue. Okay, that one works. I find in the psychotherapy field, what works is very nebulous, or what people think works is very nebulous. Or they say it works, but I find it to be very nebulous. This person has XYZ attachment style. I know what to do. I am trained in cognitive behavioral therapies. This is what I'll do. This is the kind of treatment we'll provide here. This is what I'll do. And it's either worked, and if it hasn't worked, the patient is resisting. It sounds very police-like. Stop resisting, accept this treatment.
Yeah, this same patient I'm referring to also tried like internal family systems therapy, like CBT, energy work, acupuncture. I mean, he's an interesting case for that reason, that he's also gone through kind of traditional psychotherapies, which actually seem to psychoticize him all the more. So it is interesting to note like the efficacy of our field and what we're really doing. I mean, I have a new patient recently who came in. I treated her first with acupuncture, because she came for that. And I also wanted to test my own theory. My theory being that I don't think you can use acupuncture for a psychotic because they have foreclosed the symbolic. It's a symbolic treatment, meridians are symbolic. My theory was that would actually cause him to hallucinate. Sure enough, she started hallucinating on the table during the treatment, Not that she was disturbed by her hallucinations. I think she enjoyed them, but it was information for me. And I said, you should come do psychoanalysis with me. That's what you need. That's actually the only thing I can offer you as a treatment. This is the appropriate treatment for you. And there's not even like an alternative to that in my awareness,
This is interesting, this idea of the bodily barrier and something being breached, causing something to decompensate or at least exacerbate. I've worked with a lot of people. COVID was a really difficult time for each other. Like, oh, someone's going to give you a shot and it's going to fix everything. And many psychotic patients I was working with were like, no, that sounds actually very bad. Or even the idea of LAIs, of long-range antipsychotics. Like, some psychotics are like, oh, you're going to inject me with something and it's going to change something. That doesn't sound very good at all, actually. That sounds very stressful. I'm sorry, Andrew, you were going to say something.
No, I mean, it makes me think also like with Nishi's experience about how like the acupuncture is like a symbolic treatment, and it didn't do anything but actually like bring out the hallucination, but in a way that was probably more euphoric and enjoyable compared to a non-acupuncture experience. It also makes me think of the question of like these new forms of treatment that are coming out that are considered holistic, like MDMA therapy, ketamine therapy, psilocybin therapy. Again, that's another form of like uh, uh, symbolic and even an alternative treatment for a neurotic that's just seeking something to, fulfill their lack or like, um, avoid encountering the lack because of like, a trauma they're holding on to. And I wonder the same thing with psychotics because uh, I knew some teenagers like when I was in high school that pretty much broke down with like schizophrenia, and they would do LSD, they would do shrooms and smoke weed because it would help their sort of hallucinations. It wouldn't make them disappear, but it would make them more bearable, right? But I think it's interesting to juxtapose that with your other patient, Nishi, because it's like in bringing them into psychoanalysis, what were you for them, right? Because that one patient said, like, I exist because you let me speak. Like, what are you for them? Are you just somebody who lets them speak? Or are you somebody specific that they're talking to, right?
Yeah,
That
I
brings
think
their
I'm
existence.
I'm somebody who offers them a transferential mode of being, to enter into, through which they can not only constitute a social link, but they can constitute themselves. Like this new patient of mine also made an interesting statement to me before she did acupuncture. She said that she's a martyr for the energy of other people. Again, the invasiveness in the experience of the psychotic, and the use of the word martyr. Of course, we know Lacan has already described the psychotic as a martyr of the unconscious. This is what makes them so interesting for psychoanalysis, that very fact, you know? Um, so I do think this is all like fascinating, and also what you brought up, psychedelics. It's worth mentioning that in the psychiatric field of like the early 20th century, psychedelics were originally understood as psychomimetics. This idea that the experience of these hallucinogenic substances actually mimicked features of psychotic experience. So what does that mean? It actually meant that psychiatrists were dosing themselves to understand psychosis. That was their original idea. They weren't so sure, like, should we give it to them? It was more like, can we understand them by having this experience, And then maybe we could see, like, is there a way that you could treat them with this or not, Now, of course, I think we've come very far with psychedelic therapy. And these days, my thoughts on that also is like, it's really great for neurotics. They like the release of the repressed, the return of the repressed in the form of hallucinations that are not going to stick with them, but which they allow them to see their own unconscious because they're so like locked up, You give it to a psychotic and it's just kind of like you risk. Maybe if you give it, especially to an ordinary psychotic, you risk actually triggering psychosis for them.
I have a lot of concerns about psychedelic therapy. Like it sounds like a blast, ideally, but I'm also neurotic, and I'm like, yeah, I'll take drugs for 2 hours or whatever. But this idea, this idea, I think that it's being touted as this amazing cure for trauma and PTSD. I would have concerns because a lot of people are going to be like, an amazing cure. I would love to be amazingly cured. I would love to be cured of my suffering in a very quick and efficient way. And it may lead to some really difficult outcomes, I think, for people. The same with the rise in the availability of street drugs, of high grade marijuana. I don't want to be a party pooper. I live in Colorado, but marijuana is extremely high grade now, and I think a lot of people are smoking it, and it's having adverse effects on some people who perhaps have psychotic structures.
Right, exactly. I think we are seeing it a lot with teens. It's basically, even science says things like it's kind of giving this propensity towards psychosis. We would, of course, add, in the case of a psychotic structure, of course, that liability is there. And I do think that it's the question of like breakthrough or breakdown, with psychedelics. And of course, as psychoanalysts, we're really much more in favor of working through, and the way that actually allows you to deal with unconscious material, this like flash of the unconscious, I think actually ultimately results in more repression. You get the breakthrough, you think you do, all this return of the repressed at a level that you can't actually assimilate. After the fact, I think you're more repressed than you were going in. This is like my latest thought on the matter.
It's so popular in this state. I feel like we have a very contra opinion, you and I, here, with the prevailing wisdom of, yes, let's do ketamine, let's take mushrooms with a therapist for some reason.
And I mean, I've experimented with all those things, and I've
Sure.
had very favorable thoughts about psychedelic therapy at different moments, in my thought process. So I'm not coming at it from like a lack of experience or interest. In fact, I'm quite interested in what they're all about or what they suggest about consciousness and the unconscious. But this is kind of from a clinical standpoint, I'd say like, yeah, it's better to do psychoanalysis, than psychedelics.
Yeah, I mean, even Lacan says in Subversion of the Subject that what Freud does isn't like, what does he say in that like first few pages? Like, it's not this like sort of remembering of like the Platonic soul. It's not something that produces a state of samadhi, or that's something that you could get in like a hypnotic hallucinatory state from psychedelics. Like, what we're dealing with is an unconscious structured around language, right? And that can only be um interrogated, and the symptom can only be um, formulated through the talking cure, through free association. And that's for like both the neurotic and for the psychotic, just from different standpoints of how transference works. Just to kind of summarize that, like it's the speech and it's the transference that seem to be important for the psychoanalytic intervention versus a psychoactive substance or advice in like other forms of therapy, right? This nebulous thing of what works.
If we're speaking to the point about the clinical study days, so many of the cases, and I don't want to go into clinical material of people's cases, but so many of the interventions are, this is the transference with this analyst, and this is why this intervention worked because of the transference with this analyst, rather than they were following some psychoanalytic roadmap or like some manualized psychoanalysis, or even I've heard people certainly make critiques of Millerian psychosis. And I'm like, what do you think? We got the newsletter this month? Like, Jacques-Alain was like, here are your interventions. Here's what you're going to say to the patient. Thanks a lot. I'll see you in May or whatever. But yeah, these are all highly discrete cases with highly discrete things happening. And I think that's true for every case and an analyst, hopefully.
I find it funny, like all all the sort of criticism of Miller. It's like, oh, like the elite Malarians, or like you treating Miller like he's like Saint Paul.
Or Lenin, like the picture,
What?
you got the picture of him in the corner of the classroom.
Right.
Yeah, as somebody who has spent time in editorial positions, I can understand why Miller has gotten some of the flack that he has. It's very difficult to be in the position of an editor in charge of someone's oeuvre and not be scapegoated, because you are like accused of revisionary things because of the very function that editing requires. It's like it's not an easy position to hold in relation to a teaching. So I can kind of sympathize with that situation. At the same time, it's actually a privileged situation because of that, I think Miller has come up with something incredibly nuanced, and he's self-aware of the fact that he's not just trying to give us like a fourth category or a subcategory in clinical structures. He's saying maybe this is a way of thinking about clinical structure that's progressive, that actually assimilates our clinical experience. And it definitely resonated with my clinical experience. So I was like, okay, this is a very striking intervention, actually, ordinary psychosis.
I think people have a very strong reaction to it, both because of an imaginary reason, because, oh, it's developed by a guy that supposedly I don't like, for some reason that I read about in a book that's a third-hand story. But I also wonder if it's not the implication that is disturbing to some people, that we may be dealing more with some psychotics. Even though I was criticizing a moment ago psychotherapy and psychology, they would say that quote-unquote serious mental illness is much more prevalent these days. You have these things like the ACEs studies, and even just sociologically, like somebody whose father or mother had schizophrenia marries somebody whose father or mother had, I don't know, this or that psychosis. They have a child. The child is raised in X and Y environment. I don't know. And maybe it's a class thing that many analysts treat people with higher incomes, people with higher socioeconomic returns. I have a lot of thoughts on it. It's tough to have a conversation because not everyone wants to have a conversation about why there isn't a conversation.
Yeah, it's like, what is the clinic of psychosis? What is a clinic of the real? How does that change our economic relationship to what we're involved in? Because it's very true. And I think of my psychotic analysis, like I'm often doing low cost work, because that's just the nature of the situation. They're not in a position in which to pay me what like other people pay me. And that's fine. Like in a way, it's like, just shows you psychosis and capitalism have this, there's a tension here. It requires like a different model of the clinic, a different theory of the clinic. Even it even takes us past the limits of medical intervention. It's beyond psychiatry. I mean, nowhere are we more firmly situated in the unconscious than when we're face to face with the psychotic.
I wonder if psychoanalytic training sometimes isn't against this thing. I know you've had a more unconventional training, Nishi, so have I. But I think people think, well, if I want to be a psychoanalyst, I gotta go to this great school, and then I gotta go to some institute, and then I gotta pay, $700 a week to talk to not to talk to some guy for 4 times a week because he's not saying anything, and then I gotta supervise all these cases all the time. There's an idea that the people who could be a psychoanalyst must have access or should have access to a huge amount of capital, and then to recoup that investment, they then have to, make a literal pyramid scheme of the thing, which I think probably limits who one is seeing, because if you have to recoup $100,000 in debt, or maybe you had family money, who knows, then you have to see these kind of people. It's a tough conversation for psychoanalysts to have, I think, because it involves an analysis of psychoanalysis and what is a psychoanalyst, which were fundamental questions for Lacan.
That's why I'm very strongly in favor of lay analysis, as Freud has outlined it, and as Lacan took to the next level. I do think that our training too often shapes our ethic. You know, when it's subjected to institutional forms of education and pedagogy and licensure and bureaucracy, we lose our ethic in a way that is very difficult to recover, I think. And I see this with acupuncturists as well, who are in this tyranny of the bureaucracy of their profession. It's a death sentence, in my opinion. And I think that's where we really have an opportunity, though, at the moment, at least as psychoanalysts, is to enjoy the lay aspect of what we do and the fact that it allows for this non-medicalization of the subject, which is a step forward clinically, you know?
It's also just interesting to think that we don't live in like Freud or Lacan's time, where like at some point like you could be just a pure psychoanalyst that was just like has this like nice comfy bourgeois office, and you're treating all these like middle class or people with a good amount of education to seek out analysis. Where it's like, especially in America, like psychoanalysis in the way that we understand it, in the way that we are informed and practice it or study it, isn't as dominant like behaviorism or modern analysis, which is radically different. But we're required to be, like I think I said earlier, analyst as extension, where we're in diverse institutions that are not psychoanalytically driven, like whether it's in a hospital care, or if it's in like a psychiatric institution, whether it's working with the unhoused, whether it's working with like autistic population, etc. That to use religious language, the call for psychoanalysis is a lot different. We're compelled to do it in mysterious ways that can't be systematized, but bring testimonies and question what is analysis.
I think even this idea of the pure analysis, though, is a fantasy of psychoanalysts that I've heard colleagues say, well, if I lived back in the day, I'd only have rich people who could see me 4 times a week. They would really care about their analysis rather than people who are just coming here for therapy and they're getting analysis or they're not. But I mean, even Freud didn't practice pure analysis. Like Max Eitingon, the first training analyst, his training analysis was Freud walking with him around the park. Freud fed the rat man. He gave him a meal. He's like, I can't recall why, but people today would be like, "Oh, you give a patient a meal? What?" Freud even cut sessions sometimes, not that often, but if he found a patient boring, he might get up to let his dog out and be like, "Even the dog is bored. Like, come on." And then he'd come back and be like, "Oh, now you've got something to say. Okay." He gave people advice, and I mean, Lacan. The stories are even more endless. Like, Lacan was not seeing people silently for 4 times a week on a couch and just being like a stone over there in the chair.
I mean, when he was analyzing Guattari would drive him to and from his lectures and or his seminars, and that would be considered his analysis.
Sure. That could be an analysis for somebody, I think.
Definitely. And I think that it moves analysis into a domain of experience that has many contexts. Like, its only context is really the unconscious, and I think it's a profoundly human function if it's anything. I counter these ideas that what we do, whether it's medicine or psychoanalysis, is some kind of professional function. I don't see it that way. I don't see myself in a professional function or like putting on a costume to do something for somebody inside of a role. And I know some people actually talk about psychoanalysis this way, like you got to be this enigma, play this game with your analysis, one step ahead, one step behind. And I just don't do any of that. Like, I am just a human being. I'm just myself. I offer myself in the transference through my own desire for analysis. And that's that. And I think that's why Freud did things he did, Lacan did things he did. We all have to discover, I think, the very human dimension of psychoanalytic practice and experience.
Absolutely.
I also work from home, so that helps. It's like I don't even have
just
boundaries.
Like Freud.
Yeah. I don't have that.
People today would be so appalled. I'm not appalled by that, but people are like, well, your house, I don't know. What if they find out you have a dog or whatever? Isn't that going to be a boundary? as if somebody knowing you have whatever kind of dog. You have a dog, right?
I do. I
I've
do.
seen the pictures, yeah. But like, there would be people who would not even answer a question to a patient, like if they have a dog or something. They'd be like, "No, that's my boundary. You can't know if I have a dog or not."
Yeah, I mean, my dogs are often in my treatment room. I'm interested in how they respond to people and how they participate in analysis in their own way through their own transference. People experience the transference with the dogs too. I mean, they're very cute and very, contemplative beings actually. So, I mean, Freud also was a big dog lover. He kept the dog in his treatment room too. So, I am really into
Yeah, like
that. And
cats too, right? Didn't you have cats, or was that Jung?
I
not
mean,
sure.
it could be all kinds of things. It could be a kid, maybe in some cases.
Or like
I've
Lacan getting his haircut and then like screaming at the top of his lungs when he's getting his nails clipped. Like,
Right.
one could do a lot of things. One could be inventive, but I think there's a lot of things that could happen.
I think something we were bringing up earlier that I had meant to develop further is that this idea of psychoanalysis for neurotics, like your joke, Michael, made me think of the fact that I sometimes have this feeling when I'm working with like a really proper neurotic that I wonder if psychoanalysis is just really part of the neurotic construction itself, Like neurotics go to psychoanalysis to just like be neurotic and become more neurotic, Which obviously puts the question back on me, like what am I actually doing in my function of analyst? How is this a process whereby the mechanism of repression in the neurotic is actually being addressed rather than being reincorporated by them into their own repression, And I get this feeling with the psychotic in a different way, which is that they can be kind of slippery, but they're not really evasive in the same way that a neurotic is. And they are actually quite honest and very open, which makes the transference very possible. But with the neurotic, it's almost like this is their own game, even like psychoanalysis is a game that is really compatible with neurosis.
well, it makes me think like what, even though like they have a straw man of Lacanian psychoanalysis, Deleuze and Guattari, what do they say in the beginning of Anti-Oedipus?
Right.
That a schizophrenic taking a walk is better than a neurotic on the couch. I mean, they're right, but
Yeah.
I think when you look at it, like, the benefits of like the clinic of the real, and what I think Miller is trying to really put forth with regards to Lacan's teaching is that, like, if you're really doing like a psychoanalysis proper, like, even though you said, Michael, like, what was meant for psychotics is now being wasted away for neurotics. I think like the importance of like scansion and the cut would even keep the neurotic uh from thinking that analysis or going to the couch is like a place of safe haven. Like, no, like there's no guarantee. Um, and I even think that like the point is to like, yeah, this idea in the transference for the neurotic as like, oh, the analyst is the subject supposed to know, that needs to come to an end where like even the analyst isn't a guarantee, because that is a part of the fantasy as well. And when you're able to dispel that, you could actually take ownership of your own speech and desire and associate more. And then once, you come to this point, like you don't need the analysis to do analysis anymore, or the analyst to do analysis anymore.
Mm-hmm.
Hmm. I sometimes I think the cut is one of the most misunderstood things around, even by Lacanians themselves. I hear sometimes about the most baffling cuts, or we were talking about this point of invention, the idea that one must cut, that there has to be a cut, or that
Yeah.
analysis has to be 3 or 4 times a week. That's so ridiculous. That, oh, I'm a Lacanian because I'm taking a Lacanian class and maybe I have a Lacanian analysis. I got to cut, baby. I got to cut. And who's that for? If it serves the analysis, if it serves the patient, not in the sense of making things comfortable, as you say, Andrew, but of moving the analysis, of working through something, yes. But if you're just cutting because you think, well, I have to cut. I wrote Lacanian analysis on Psychology Today. I can't falsely advertise. I've got to cut. I'm a Lacanian. No, it's ridiculous. I think even these things have to be analyzed. What is a Lacanian analyst? What is an analyst at all? Because there's so much fantasy around these things with analysts. Like, it has to be this way. No, it can't be this way, which in itself is extremely neurotic, putting things in different boxes.
Yeah, that's kind of what I was getting at too, the superficialization of the technique. That it's almost like a mimicry, or it's laughable, honestly, because it actually sidesteps the very depth of psychoanalytic technique, what we really mean by technique when we use that word. And yeah, I just feel like we have to, when I think about what is an analyst and like what does it mean to follow Lacan, like sometimes I even hesitate to say that, like, oh, to be Lacanian or not to be Lacanian. It's like, to me, Lacan is somebody who demonstrated a fidelity to the unconscious, period. That's
Completely.
it. That's how I see his teaching. That's what's so beautiful about it. It's wide open as the unconscious itself, not as like, this is my idea, pedagogy, like you're gonna follow this teaching and something. It's way too open and labyrinthine for that, and it's evocative. It's written in a way that
Really gets the
allows
people
for
going.
it gets you have to have a transference with it, and then you can go somewhere, and that's kind of what it exists for, rather than like a code. And so I just think, yeah, an analyst is just somebody who takes the unconscious as what their fidelity is in relation to, period. That's how I see myself.
I'm reminded again and again by my favorite decree, the Situation Training Psychoanalyst of 1956,
Mhm.
6 or 3.
I think it's
Doesn't
6, yeah.
matter. But he talks about the humorless tough talk of all these well-ensconced analysts. And I think the same things can happen in Lacanian circles. You can go to these conferences, everyone's wearing black. For a profession predicated on humor and jokes and the lapsus, nobody's funny or even seems to understand what humor is. Uh, it's too serious. It
Mhm.
defies invention when there's the fantasy of what the analyst has to be. And
Yeah, and also,
I
I was just gonna say also like the appeal to certain aesthetics. It's like, sure, I'm into Lacan, but like I don't know anything about like why I'm supposed to like this Goya painting or these like typical like
you know
paintings or tragedies that become
the
so Lacan.
bandage head people or whatever.
Yeah, I'm just like, I like to watch like, I don't know, Cobra Kai. I like to drink,
Yeah,
Miller
well,
Lite, and
yeah.
I'm a typical like Mexican American dude. Like that's not my aesthetic. I love Lacan, and like I like learning about this theory and the practice, but like I don't really find myself like compelled to copy the aesthetic that everybody's like art, you know. Even like, was it Tom Savola at the conference? He's talking about that one like Latin American singer that he it's like, that's dope. Like, that's not like the
Yeah.
typical like European Lacanian like, aesthete. Like these are just like, it's pop culture.
hmm we could make a real fortune if we started bottling Malare Light.
That's what I was to say.
I
That's
made
so
a
stupid.
meme of that too.
I'm sorry. I'm sorry.
That's
Oh, that's so
hilarious.
stupid.
Yeah, I totally agree with you, Andrew. I think that, again, that's why Lacan made it so clear that the only thing he had to say to people who wanted to follow his teaching was that psychoanalysis is a style. And so to think that somehow that means we have to imitate Lacan or anybody else for that matter, or like mid-century European Parisian aesthetics or surrealism or anything else, I think that would miss the whole point. We have to kind of find the aesthetic that's true to who we are and true to our culture and true to the transference that we're here to invite people to. Otherwise, you
And,
can't even have transference because you're in mimicry.
right. You're one is as good as another. This is a really nice question though about the Lacanian aesthetic that gets adopted, because it's always like the same dozen images and these songs and these people. And I guess I don't know. I think there were things Lacan liked, or maybe that's someone who likes Lacan likes. But there's such a wider world that analysts can engage with if they can get outside that what does he call it? That would be a nice episode about the situation training of psychoanalysts,
Mm-hmm.
because in a sense it gets replicated in a lot of ways in a lot of places. Like, this is what we call an analyst. Now, I'm of the opinion an analyst should have some kind of trainings of something. That's up to one, rather
Mm-hmm.
than just like, I bought the Acree, I'm ready for it. Yeah, there's people like that too, but I don't think it should be so standardized, the licensure. Now, I have a license or whatever, but then I still have colleagues in the IPA who are like, yeah, but you're not really a psychoanalyst because you're not in the IPA, which is the same thing that some Lacanians do, where they say, yes, but this is this Lacanian club. So I don't know if you're really cool with it.
This is what happens in any field. I think it's one of the reasons why I participate less and less in medical, circles, because it becomes self-enclosed and it even develops like an internalized language. it's kind of psychotic in a certain way. It can be, you know, in that like something substitutive gets constructed in place of the actual thing, you know? Um, and then you get all these strange like sociopolitical dynamics around the thing, and it's like you're just part of something. And I just, you know, I can't have anything to do with such notions because it would inhibit my own practice of psychoanalysis and the transference that powers like the entire meaning and mechanism of what I am and do, you know, with people. And the fact that they show up asking for psychoanalysis, that only happens also because I'm allowing myself to be in a certain mode of being, you know?
Yeah, absolutely. It's as somebody who supervises people, I see it very much where they think, well, this is what it says in a certain book about technique, that let's say, and so I have to do it because this prominent analyst wrote about this in a certain book about technique, or these are what the analysts that I like and go see do, so I have to do it too. Thankfully, some people are just like, oh, I don't have time for that. I'm going to pursue an alternate training, but it's a very seductive thing to think that one day you could sit at the big table.
Right. And that would be very unfortunate. I think this is exactly Lacan's teaching is a critique of this very motive in the human being, I think. You know,
You know,
that's why I
that's
got
what
kicked out of the IPA.
right, because you wanted to drink Miller Lite, not IPA. But
Very good. That's
but
that's the callback.
but I'm also thinking, because I haven't read that essay in the decree. Actually, I think we probably should read that after after Nishi. But it's funny that you evoke the decree, Michael, because he even says at the beginning, I think it's called like the overture, where he says like that the objet is a sort of style, and that his style is oriented around like the objet petit a in his writing. And I think like even when you read the seminars, like sure he's talking about psychosis, sometimes perversion, neurotics, and we're reading all these different essays and case studies in Freud, but it doesn't really tell us specifically how to interpretate or how to make an intervention or how to diagnose necessarily. Like he's giving us all these ideas and concepts, but like it's not a recipe book, right?
Mhm.
Like, and even if you try to do that, you're kind of like doing a disservice to yourself, because then you don't develop a style. Like, you know, I was trying to compare it to cooking, like, you know, that's a recipe book, but like I could make, I don't know, like you know, follow this recipe of like penne alla vodka, and then like I have somebody that's like just learned how to cook like from like just being raised in this part of Italy their whole life, and they do that, and mine just doesn't come out that way, the way they do it, because they have a certain style, they have a certain sort of savoir faire to it, they have a certain way of doing and how to like work with things with what they have. It comes from experience, and just being able to like constantly practice versus trying to follow a rule book. Like uh I mean, I think you could probably even like put a bunch of things into Chat GPT about like Lacanian psychoanalysis, but that's not going to make you an analyst. Like with all those
Sure.
different ways of like, it all comes down to experience and style, and the way that you practice, and that takes like time and just, I guess, probably even your own analysis to know about yourself to be able to do that.
That's very key, because one has to have an analysis that works for them, and not just one where they're like, this is the top guy, and maybe the top guy is very good, or the top girl, the top woman, but uh, to really make your own moves, I think, is extremely critical. And to bring it back to it, I mean, that would be how one would work best with a psychotic, I think, to really be able to incarnate a different kind of an object, a different kind of a transference, rather than just like a Xerox of 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 a Xerox, like where you're, 30 years old living in Ohio and smoking like twisted cigars or something, like wearing like a cravat. Like that's not you.
Yeah, I
Maybe
think
they
you know
really
what,
like cravats. I don't know.
it's like it's also, I think, the question of how your own analysis lets you refine your symptom to the point where it does become a style for you. It's something you can embrace as style, you know? You can't do that till you unravel, till you refine that symptom. And I think also on the question of pedagogy, psychoanalysis is like traditional arts in this way. Like medicine used to be transmitted orally. It didn't have this like textual, go to school, get credit hours, 2,000 clinical hours, pass board exams. Like this is all made up, you know? This has nothing to do with the verification of competency, efficacy, anything, the function. And I think it's exactly the same with psychoanalysis. It's a talking cure to begin with. The entire teaching, as Lacan demonstrated so well, is an oral transmission. This is the only way you can learn. You know, it is a discourse.
It's also funny that you say that too, because once it becomes written, then like something dramatically changes in it. And I'm thinking of even how like Chinese martial arts is like passed down, not just like with the movements that you do, but that it's like orally taught. You don't have a writing curriculum. And even if like these old ancient Chinese masters were to write something down, they wrote them in the form of poetry.
Mm-hmm.
Like white crane spreads wings, the monkey goes over to the tree and steals peach, right? And you
Mm-hmm.
just think that's a lovely poem, but actually no, that's like a memorization of a certain sequence of moves, right? But then
Mm-hmm.
once lineages are created, then there's formal writing, and that like loses the transmission of like what it was really like supposed to be. And I think there's something like sort of analogous in the way that uh the transmission of knowledge is passed down like vis-a-vis orally versus like the written and like the literal written, not like the
Mm-hmm.
poetic.
This is one of the things that works for me in the Lacanian orientation and at the Lacanian compass and the NLS is like you heard these cases is they're not just oh great case, thanks, we all agree, but an interrogation of the case itself, a lot of questioning, a lot of discussing, not in a way that I find hostile, although I've certainly seen more contentious discussions, but of a way of saying, let's continue to analyze analysis. Okay, well, now we've had 11 cases. What does that say about analysis today? Let's have 12 more next year, 15 more, 9 more next year. Let's continue to build a body of knowledge, but continue to evolve it and continue to think through what continues to happen in psychoanalysis. Let's keep trying to analyze analysis, which not everyone seems to want to do.
Right. That is actually the fundamental analytic act. And I think that's something I appreciated in Miller's lecture on ordinary psychosis also was his desire to analyze analysis, his desire to push psychoanalysis further, which I think there's nothing more Lacanian than that, actually, that motive, you know? Because Lacan's whole teaching is an analysis of analysis. You know, it's a way of saying, what is psychoanalysis? How do we actually discourse this? You know, theory of the unconscious and so forth. I mean, that's very different than anything that exists before it or after it in my experience, you know.
I think maybe right here we could probably transition to actually talking and weaving this into like what happened in the clinical study days, obviously without disclosing case material per se. But again, what I mentioned, this concept of misunderstanding sexuality, which I believe is going to be talked about at the what is it, the Congress in
Mm-hmm.
Paris,
Mm-hmm.
um, which I have no idea what that's going to be about. But this obviously we have this concept in Lacan in the later years, like from the early 70s till even now, of the sexual non-rapport, or this idea that there is no such thing as a sexual relation. You know, love isn't this thing of pure reciprocity or symmetry, but love is, very much it's a gap, and it's even could act as a fantasy to supplement the jouissance that comes from, the non-rapport, that man and woman don't go together like, hand in glove, right? That there's a huge antagonism in that, but that's love. But how this ties into ordinary psychosis and what we've seen generate in the theme of this event. I mean,
It's
if you're willing to talk about your own cases, that's perfectly fine. Yeah.
no, I mean it's a good question. It's just I don't know how to answer it because I'm still thinking about it. For me it's more the bodily experience
Mhm.
of the whole thing, of getting to work with other people, getting to hear their cases, maybe getting to present my own, getting to hear works of different cartels,
Mhm.
uh, getting to meet new people. Like there's always a clinical study days and there's always cases, but for me the experience
Mhm.
is what's important, of working with others.
Yeah.
Yeah.
I found, and I even found like, yeah, a lot of the talks were interesting, but like all the good stuff happened like outside of the talks, at the cocktail party, at the lunch breaks, etc., where you see people working through these things. And I even like that they had a panel for the cartel, because I think this is an important thing. Um, that I'm trying to, Anishi and I are trying to incorporate, and Ellie as well. She's in a handful of cartels, as are you. But for people that are new to psychoanalysis and maybe have come to psychoanalysis from like the theory bro stuff, and I like Miller when he says in this essay on ordinary psychosis, what does America want? They want Slavoj Žižek. They don't want to read Lacan. They want Lacan from the mouth of Slavoj. And I came to Lacan from Slavoj, but it wasn't enough for me to be like, okay, like I only care about philosophy and theory. Like I went into my own analysis. I'm still in analysis, and this idea of the cartel is really interesting because it is not the same as a book club or a study group, right? And it's
It's
like,
it's
I was just
also an
gonna
orientation to a school.
exactly, it's an
So
orientation to the school, and it's the difference between reading a singular text, in my opinion, tearing a text apart. That is, you could say, resemblant of each person's trait, and each person's what is it? What are their questions? Like the traits represented by questions that they have about psychoanalysis or something in psychoanalysis, be it the family, the symptom, a group, all these things that just generate more questions than certainty.
I, I think even the kind of a format of a clinical study days should not be confused with like a conference, because I go to conferences and they're fine. The food is usually worse and there's less dancing, but it is
Yeah.
what it is.
Mm-hmm.
But the idea that the person presenting can be at whatever level of experience, and they're going to talk about the case, and
Mm-hmm.
someone else might discuss it, but they're not the expert.
Mm-hmm.
The person who is conducting the cure is, and they don't have to be a member. They could be from anywhere. They could be part of any kind of a thing. I find that very useful and interesting, that it's almost inverted. You will tell us about your case and we will learn from you. And again, sometimes there is a more contentious exchange. I didn't observe any this year, so good job, I guess, everybody. But also the idea that there's not one figure going to take up too much attention. I recall going to some of these Lacanian conferences, and big people during the Q&A thing will get up and give like just basically another talk instead of asking one question. And that's all the Q&A time, because somebody important wanted to talk about something unrelated. I don't like that stuff. I don't think it's useful, and I don't think it's very interesting for newer people in the field, because then I think that just reifies that idea of this is what an analyst is. It's somebody in leather pants who's too old to be wearing them, who is going to talk at length about something that we're all going to listen to you, rather than let's listen to the logic of the case of a practitioner at any level. Although I will say usually it's newer practitioners who present. I've never seen anyone with like 25 years be like, wait, I have to tell you this about a case. So
What I also like too about that, I'll just say this, so I can let Nishi speak if he has anything. But that even when like the experienced analysts that were presenting cases, like they weren't necessarily like gung ho certain, like this is that and this is that and that's it. But you had other practicing and experienced clinicians in the attendance that were questioning, like, well, what about this detail of the case? What struck me was what you're saying, that the patient said this and that. Could this be a psychosis versus this or that? But it's like, in a way where it also exemplifies that this wasn't a closed case. Like, this is what this person is, and then they finish their treatment. Like, it's still ongoing treatment, but this is the case that I've written up and present to investigate.
I'm sorry, Nisha, you were going to say something, please.
No, go ahead.
I personally love when I have the experience of hearing something and I said, I've never thought about it that way, actually. And I think that's going to do different things when I go back home and see this person. But then also when new people ask questions, just say, well, I don't know if this is a good, can I maybe just, I'm like, no, ask it. It'll be good. It'll be good.
Yeah, I think just listening to you both makes me think about psychoanalysis and extension, and how one's personal analysis eventually moves into this collective assemblage, the cartel being like a group analysis of sorts, and Lacan's teaching that the position of the analyst and the analyst are actually fluidly exchanged, ultimately. And I think that's something that I'm heartened by in the psychoanalytic field, seeing what Lacanians are up to as well. They really seem to embrace this collective idea, group work, inquiry, and like assembling themselves into a circumstance for discourse and inquiry that is really, really healthy and positive and necessary, and is actually a direct outcome of psychoanalysis. That psychoanalysis does actually move in the direction of social change, in my opinion. And here I agree with D&G a bit, that they also kind of foresee a function like that, despite their critiques of psychoanalysis. I think this is how psychoanalysis actually becomes something that has cultural impact.
Yeah, yeah. I also think like too, like a lot of the things that are put into question is like the free clinic, which I don't know if people are actually doing that, but that has come up, in some conferences that I've been to, or just going back to this notion of analyst as extension, like as you were saying, Michael, like this idea that there was like an analyst back in the day that was just a pure analyst that had this nice cozy office and they just like saw patients every day, 4 times a week. Like that's a fantasy, right? Even for Freud, like he wasn't a pure analyst. Like sure, in his writings he probably appears that way because he's thinking about psychoanalysis and what this might look like as a science, but he was doing all these things, even having colleagues bring their daughters or for an analysis, or like the little Hans, like he never analyzed little Hans. It was his father that was friends with Freud, and I think did Freud analyze his father, but he was going in like, this is what my son's doing, this and that, like write a case on him. um and so I guess I'm just like perplexed at like how this discourse and practice is transmitted, as Nishi's saying, in culture, what this would look like. And to like cap this off, like even someone like D&G, or like not D&G, just Guattari, because Guattari was a practicing clinician. Like he did the Laborde clinic where he was working with groups of schizophrenics and various psychotics, but being like a freaking edgy teenager mentality. He's like, I'm gonna do schizoanalysis. But it's like, bro, you're just doing analysis. Like, just stop. You're just doing analysis. You're just doing it in a way that we would see as beneficial today versus back then, in a way that's not like stereotypical, right? Or stereotypically Parisian.
Right.
I wonder then, to bring it back to this question of formation, but also of who Lacan is for, what people see being an analyst as and for. There are theoretically better ways to get rich. There's probably easier jobs. But then I think of the academic side, the signal to noise ratio with professors and dissertations is, so clouded. So, okay, how do you get it through? The Lacanian analysis of, I don't know, whatever, post dang China, something like this, whatever people write about with Lacan. But it is this kind of professional Lacanian class, or this class signifier, I think, that does seem to block certain parts of psychoanalysis from evolving further. How many Lacanian books come out a year? 100, 200? How many of them are worth a shit? How many of them are worth reading? Just it's unanalytic, but just because you have something to say doesn't always mean you should say it.
It's like you have that book, Think and Grow Rich. Now you have Speak and Grow Rich for Lacanians.
Yeah, that's great. We'll write that one. We'll go on the other Lacanian podcasts and promote that.
Oh gosh, that is hilarious. But I think it brings up for me like something I think about a lot as what I see as the future of psychoanalysis, which is I think psychoanalysis is cool. I think that it should be cool. People who practice it should be cool, warm, generous individuals who like you want to talk to them. Like you feel like this is something really like cutting edge to be doing, actually. Like not Victorian or some like medieval thing of like, oh, Freud is so outdated. No, the Freudian discovery is like radical and it's like absolutely innovative, and that field is evolving and developing, and we're pushing the project further, and we're relatable people who don't just write like super dry, like mathy discourse to call that psychoanalysis, but we actually engage with like what Lacan meant by formalization, why he used mathematics, what psychoanalysis is something that mingles with so many domains of knowledge and expression. Like, is there a pure psychoanalysis? Well, I don't know. I think it's just it contains so many things that to extricate it from that would be artificial, in my view, also. Like Freud collected all these antiques too. Like he was very interested in culture and like so many other things, literature, and I think that is a model for a psychoanalyst in a way, to have broad interest, to be somewhat polymathic, perhaps.
Absolutely. Yeah.
I guess to be like cut and dry about this, like, you know, it's not like this like analytic discourse and even experience is something that is like consistent and continual. Cause like what Nishi and I were talking about, and I think our last episode on function field is like you could walk into the analytic office or the couch and be associated, but that doesn't mean that the analytic effect is happening. Like it's something that's sort of a rupture, to use a fancy term. It's something that happens instantaneous, but that we have to keep coming back to. And I wonder, in your experience, Michael, like, working in many institutions, like how many people that maybe did not know like about psychoanalysis or even have ever heard of the term Lacanian psychoanalysis felt an analytic effect from just allowing them just to speak. Because it seems like just in other like institutions and modalities, like sure, like we're talking, but you're not really giving the patient the opportunity to feel like a human and speak.
I mean, quite a few, and I don't even know how fancy it needs to be. The idea that one could just listen without prejudice or without thinking, I need to be doing an intervention. Okay, I need to write a note. I need to show I did something. This needs to look a certain way, but really just to ask somebody something as prosaic as like, what's on your mind, and genuinely be asking like, what are you thinking? Like, that's not so complicated to me. It is complicated to other people because there's an idea that you have to be doing something. And counter to what people might think reading Lacan, you might not have to be doing anything other than really just listening like Freud would say, with that evenly suspended attention. So, as a way of answering your question, I would say many people can feel that analytic effect. Uh, it really sometimes is simple as listening and then asking a question that they've maybe never been asked. Um, I mean, I think of the many times I have gotten patients from other people, like, yeah, it's anxiety. Then you ask three more, four questions, something perhaps far stranger is going on.
I like this articulation of analytic effect because for me, it also brings up like psychoanalysis as a way of life. And I think, Andrew, we've talked about this a little bit, like gong fu and things like that, like psychoanalysis as like a gong fu, like a way of being and a practice. It's not just something you do like when you go see your analyst or when you're being an analyst. It's like I think that everyone who comes into like my field is experiencing an analytic effect because I'm constantly engendering that in some way because I'm interested in that, because I'm exploring that, because I'm functioning like that. It's like, it doesn't mean they're in analysis with me, but that doesn't mean that they're not going to receive an analytic effect when I'm like with them, listening to them, or they're sharing something and I'm just freely responding to their discourse. Is that an analytic intervention? I mean, yes and no, and I think that what it means to practice psychoanalysis is like extremely universal in that sense. It's like it's not a game or a put on. And like when I'm listening to my patients, I don't think I'm like in some superior position, like I'm the analyst, like I'm here to do something to you. I'm in analysis myself too. Like I don't know, what to say or do. I just allow myself to respond to them as a human being who has also studied, the unconscious, attended to his own analysis, etc. And it's like Lacan said, a desire of the analyst is an experienced desire. That's the only difference in a way that makes the transference interesting and workable. And so I don't know. I don't really. I see myself switching between analyst and analysis like all the time, and just kind of being open to free associating with people, but also being open to like intervening with them in a way that's helpful.
Yeah, I mean, I think just like it just shows I I think it's just like how flexible you have to be in this experience. It's of course free association matters. Shouldn't, bar the ability for anybody to speak, but it seems like ultimately like all these seminars that one studies and reads, have to be tossed aside when real shit happens, when real experience happens, because the unconscious is structured like a language, not structured like a Lacan seminar that you've read like numerous times. And I mean, just to go to a seminar real quick, like in seminar 5, when he's talking about the metaphorical creation that happens at the unconscious with this like familiar word that he's talking about from Freud, it's um it's exemplary of the fact that like anything could happen with the unconscious, from something as simple as like listening or just being like, hey, what's on your mind? What are you thinking about? Say more. And it doesn't have to be as grandiose as a slip of the tongue or a metaphorical creation, but that anything could happen. Like what I liked about like the Lacan compass and this CSD was that there, I think like almost 80, if not 90% of the clinicians were Spanish speakers, and how like they deal with patients that speak Spanish and English, and the fact that like something could come up where like Spanish and English merge into one word that doesn't obviously make sense outside of the clinic, but like in this instance, it's like language that's molding onto a sort of traumatic memory that can only be expressed in this resonance of like a bilingual slip of the tongue.
Hmm. Yeah, and to kind of tie that into the sexual non-rapport, something I was thinking while you were talking is like how Lacan describes psychoanalysis as something as artificial conditions, you know? We're creating artificial conditions for
That's
people
true,
in a
yeah.
way, right? And but that also makes me think that it's so rare in human relations to be given an invitation to speak. And for the person making that invitation to have a genuine desire to hear what you have to say. This is the psychoanalytic act, I think, and that's why I keep going back to the fact that it's a human act, but it's also a cure through love, you know? But this is a very different kind of sense of what love is about, and I think usually people communicate and they come at each other with the communication. It's like it's not an invitation to speak or necessarily an invitation to listen. It's kind of like a battle. It's a battlefield of discourse, that meets somewhere here in a gap, and nobody's aim is really realized in that. They just kind of meet in a gap. And I think that's the non-rapport. Something different happens when you actually don't seek reciprocity, but you accept dissymmetry. You accept that there is a gap, that there's a possibility of jouissance, no longer being alienated. And then I think, have what something I would call transferential. Love is something operating in a transferential structure, is basically what I'm trying to say, rather than like rapport, which, is interesting because in medicine, the idea of rapport is idealized much more. And like I was taught things like in acupuncture, like, oh, you can kind of mimic your patient to get them to like trust you more. And you can sort of like exaggerate an affect that you think they're animating, and that will kind of give you a clue into whether that is their actual affect. Like if they're really angry, you can sort of be tough with them, and like, do they eat that up? Do they like that? Does it provoke resistance? Um, this kind of thing, and it's this idea of getting them to think that you're sort of like them, that you're kind of you represent to them a reciprocal relation, and this gives you an in to treatment. And I would just slash that whole idea and say that that's imaginary in a certain way, that it's artificial in a negative sense. What medicine can learn from psychoanalysis is the role and function of transference.
Oh, I like that. I like that a lot.
I I wanted to ask more of like a sort of off topic question, but like for you as a practicing clinician, even though we're talking about experience versus like all these Lacan books that just come out or just like memorizing seminars, what do you think resonated with you as far as a seminar or an essay in the Cree that really is a testament to how to practice technique and something that can allow as like a sort of navigation when you're working through this experience? It's kind of like a like a really broad question, but it's like, what do you think helps, like, at least, like, because it's not without. text or studying. We still have to study teaching.
Two come to mind on any question preliminary to any treatment on psychosis. I always kind of get the wording off, but you know the one.
Yeah.
And then the Situation and Training of Psychoanalysts of 1956. One a little clearer than the other, but I think they're both very instructive on these are some ways to practice.
Yeah, we did the preliminary questions on psychosis course with those at Maria Christina, right? Yeah, that was a really good one too. And also, like, what was interesting, that little schema at the end, like, he doesn't go over that in any other seminar. Like, it's only in that specific essay that he brings it up. But it is interesting to see that, like, when he's breaking down like Schreber's speech, and this kind of goes back to like what Miller is saying in like Ordinary Psychosis. It's like there is metaphor in psychosis, but it's not neurotic metaphor of the name of the father. It's a delusional metaphor. And I really liked how Miller kind of broke that down in this essay. And like how, like, in a sense, we don't have the name of the father anymore, but like a name of the father that sort of tries to fit in to some delusion or whatever it is that is troubling for the ordinary psychotic, or that they're trying to use that to have a sort of stabilization, a name of the father versus the name of the father. I think there's examples of like work or certain positions like being a father, being a husband, etc.
I also really like what Miller was saying about the name of the father being in the position of the predicate rather than like the proper name. I think I'm getting that right. But I thought that was quite brilliant, actually, the way that he showed this nuance in relation to the foreclosure of the name of the father and how, in ordinary psychosis and extraordinary psychosis, it was very much on point. And also, to add to what Michael said, I would say that the essay in the decree, the direction of the treatment and the principles of its power, is one of Lacan's great statements on analytic technique and transference. And I think it follows on a question of any possible treatment of psychosis, or it's positioned very close to that essay, which I thought also was instructive. In other words, like, you really need to understand that when you're working with psychotics, because what you have is something transferential to work with, and that its direction, you can actually direct treatment through transference. I think that's a very important point. It has laws in a certain sense, and it has interventions that we enact. But like Michael was saying earlier, the cut has become this kind of like laughable notion in a way. It's so exaggerated or cartoonish. And I think really all these analytic interventions are very natural. When you're actually attending to the transference with the person, these things naturally happen. You don't have to think about it like, oh, I got a cut, in order to make a scansion, but, I think it's just, Lacan was just articulating things that he did, that he noticed, and making it conscious for us.
Yeah, I don't even know if he cut with everybody. There's so many really strange things in the Rudnetko biography which are kind of refuted in other places that it's interesting. It's a collection of mostly weird stories about Lacan, though, which other people are like, well, yeah, I also knew him and he was weird sometimes, but not all the time. But even this idea of the multiple times a week analysis, it can be good to see someone once or twice, maybe, but maybe not. Maybe you don't need to. Maybe it's good to see some people once a month. Maybe it's good to see some people once every few years. I don't know. It's the invention can go both ways. To copy Lacan's style to me is that's funny, that's interesting, but I don't think that makes an analyst. That just makes a parody.
I forget the dude's name. It's an Italian dude that I think attended a lot of Lacan's seminars. Our buddy Nick, he's the one that told me this story. His name is escaping me, but like he, I think, had like a professional, like I think he was a professor And he didn't really have like a lot of like high self-esteem. He was like kind of like just always there and nobody really acknowledged him. And then like one day he's like walking down the hallway and Lacan is right there and he's like, "Hey, my God, like what's up?" And like it like shocked him, and like from that day he went to an analysis with Lacan, and then there was a cure for him. And he says like Lacan was somebody who has like just the utmost simplicity. Like Lacan was a simple man. But it all started from just like walking down the hallway and like Lacan's like, "Hey, my God, what's up? Like you're that guy."
It's true.
Yeah, and that really, I think, fits in with the way that Betty Milan describes her analysis with Lacan, which I think is one of the better testimonies out there to Lacan's work as an analyst, and how that function is actually related to his humanity rather than this idea of like Lacan, this charismatic, like crazy wisdom type figure of psychoanalysis, and then like, oh, but he's also an analyst, but he's kind of a weird analyst, and he does strange things. They kicked him out of the IPA, like, is he Freudian or not? Like nobody says these things, signifier. But actually, I think Betty Milan's description of analysis is so rich in the way she describes the transference with Lacan as the primary event, like his warmth, his invitation, his desire was maintained, to the maximum. And this is very instructive, I think, to all of us. And as a way of working, it's actually quite simple. And to your point, Michael, I've thought about these things too, that our culture is very different now. Like, you're not going to get people who want to come every day for analysis, It's like more of a weekly thing, I think, is kind of the most frequency that I use is like, come see me every week. And the unconscious kind of conforms to whatever frame you provide it. Like in between that weekly session, a lot of cooking happens, a lot of stuff comes up. They come back with like so much to add to the container to speak about. And I think that's more than sufficient. But I also do something a little bit unusual, perhaps, which is that I allow some of my clients to do like on-demand analysis with me, in the sense that I let them contact me like in the middle of like whenever, and they're like, "Are you free? Like, can we talk?" I'm like, "Yeah, let's go." And
Absolutely.
that ends up sometimes being 4 to 5 times a week with certain people. But
Of
I
course.
let their desire initiate that. But my desire is ever present in that I'm willing to respond to that gesture. I love doing analysis.
I have the exact same experience. Yes, I'm glad to hear somebody does it that way too, and I didn't just invent it myself.
I'm glad to hear that you do it too, because I think it's cool. I love it. Why not?
The one time I really saw people 3, 4, 5 times a week was when I had a certain job that I'm not going to go into, where I was working with people who had just experienced certain kinds of acute crises, and I said, "Well, no, come back tomorrow. Well, no, come back the day." But I also knew that in their life they were in a moment of mourning and weren't doing anything. So I was like, "You can be in bed, or you can come into the office. In fact, you can probably do both today." But yeah, that very much like if a patient is like, "I need to speak with you," I'm like, "Great, let's speak." And I might have to be like, "Give me 20 minutes to go wrap up or be in a quieter place or something." But yeah, like absolutely. This is something of Lacan's we should emulate. There's a wonderful idea that when he would work with people in crisis, they would kind of just hang around his office all day.
Right.
And he would be like, "Oh, yeah, I'm ready for you now." "Okay, no, hang around a little longer. Go get lunch. I'll see you in 90 more minutes again." Like something like this. I think that's very much a contrast to the idea of Lacan as being this like gigantic French asshole that we don't want to deal with. No, this is Lacan who's like, "No, really, it's really good for you to keep speaking. You're in a tender moment here. Keep talking with me. Let's keep in contact."
Yeah, and making yourself accessible.
Mm-hmm. That also makes me think, and I want your opinion on this, guys, because like there is a trend of a Lacanian practice. I don't want to exclusively say it's only in America. Maybe it's in other parts, but the way that I see certain clinicians advocate the way analysis should be practiced is that all you need to be is just a voice. And so thanks to modern technology, you could have analysis over the phone, or if it's for Zoom, cameras should be off. And what you guys are both practicing, the way you practice, seem to contradict that, because it seems like the presence of the analyst isn't just in the voice, but also in the desire and also in the body And I think this is where, like, I think you said offline, Michael, about like the importance of, having like in-person analysis at least like once or twice a year if you can, because there's
Mhm.
something about that versus just like this aspect. No, you just need to be a voice. That's it.
Sure. Yes, I would agree with the idea that analysis needs to be in person sometimes. I personally, this is just me personally, don't use Zoom or video components unless asked to. I'm not opposed to them, but because I'm sort of mobile and have a lot of shit going on, I find it easier to just have this going on. But that's probably has more to do with my own age and particularity and the fact that that's my own limitation with technology. But no, absolutely. I shouldn't even say that because my analyst is older than me, and we're always on video. So maybe that's my own resistance. I'll go chop that one up and I'll send it back to you. Thank you.
Yeah, I wonder about these things myself because I don't think that the virtual medium is it by any means a reduction of the efficacy of analysis. That's definitely not true. I mean, it does work virtually. That being said, when in person is possible, I do prefer it. And I do find that there's something in the transference that is more palpable and manageable to me, more directable by me. And for me, I think it's more at the level of like energy and aura. It's like the fact that there's two bodies actually in the room in a field together. That's not like completely abstracted to the voice and the linguistic, but that there's this kind of it's a somatic component for me, I think. And I think that it is for the patient as well, the fact that they recline. Like I do use, I mean, you guys see my couch. Like I do use that setup. I do think that it works at the right moment, for that. I am face to face for preliminary part of analysis and maintain that if I'm doing virtual, although I have one client who prefers no video component. And so it's just voice, that's fine too. I do wonder though about like analysis becoming too virtualized. Like I feel
Mhm.
like that's a concern of like, okay, are we gonna lose like a human dimension? Like used to go to Freud's house, you could like walk up to 5 Rue de Lille and like hang out in Lacan's waiting room, and there was this kind of like embodied culture around analysis. Like go to the cafes, talk about the latest Lacan seminar and like being in analysis, and now we're just kind of like nobody's anywhere. I'm just sitting at my computer like doing analysis, and I just kind of feel like, I don't know, that's not as enriching for me ultimately. I want this like cultural aspect, this embodied aspect.
I think there can be a nice mix. I know historically the way French Lacanians practiced, even until fairly recently, was via the tranche. Was you have to come see me 2 or 3 times a year in France, even if you live in Argentina or America or whatever. Now many of them have softened up and are like, I will use Zoom. We'll talk a little more or whatever. But I still think that in-person component is so important, even if you meet with somebody not as often like that. Okay, well, we'll talk on the phone 3 times this month, but you're coming in the office on the fourth.
Mm-hmm. Mm-hmm.
Okay, I know you live here and I live here. Let's figure out a time that you can come into the office, or we meet halfway or at a conference or something.
I like that hybrid idea. I think
Yeah.
also it's like, um, what was I going to say? That it does create something, like having them come in person, because I do feel that the online is even easier when there has been like an established transference with the person. And then let's say they move somewhere.
Hmm.
I can't come in
Hmm.
person anymore because I moved or I'm traveling or I'm going to be away. Then you go online. I feel like it really is quite smooth. And if you've already gotten to the couch, online is almost like a replica at times of that, especially when you remove the video component.
And even wanting to work with certain analysts that might probably live somewhere else. Colorado's nice, but it's not New York City. It's not Paris. I might want to work with somebody who, for some reason, is somewhere else.
It's true. It's
It's
true.
true. It's not Miami. Miami
That's
was
nowhere's
my
Miami.
Miami was too real.
I know.
But what the next CSD is in uh
Chicago.
Chicago, the Windy City. I haven't been to Chicago
Windy.
since I was in boot camp.
Perhaps we should all consider going. I think it'll be pretty good, and it'll be
Yeah.
a bit of a shorter flight here from Colorado.
Mm-hmm. Yeah, I'd consider going for sure.
You should submit a case. I think it would be probably well received based on this conversation.
Mm-hmm.
All right. I've got some interesting ones I could try to write up.
And then this summer is the linking seminar, which is different from the CSD, but is still tied in with the.
Yeah, the linking seminar here at the Denver Vector of the Lacanian Compass is this summer's hottest psychoanalytic event. It'll be at the Denver Art Museum, and we're going to hear the presentation of 3 cases. We're going to have a theoretical lecture in the morning by Isolde Alvarez, and a brief talk by Juan Felipe Arango about the school. But it won't be long, something like 9 to 3, and then we'll adjourn to a local beer garden, the Schoolhouse, which is right next door.
Nice, and that's where all the real analytic.
That's the real. That's the real. The
Yeah.
real.
That's the real.
Beer garden.
Yeah.
Yeah, it's exciting. It's like local to Michael and I, since I'm in Boulder. So it's exciting. Yeah, I think it's really cool what's happening here. I think, as we had noted, like on another call related to that linking seminar, like the concentration of younger analysts in the area is something really promising and exciting, I think.
Absolutely. Yeah, analysts who know how to use Zoom and don't just say I'm too old and I use a phone. So.
Yeah, totally.
I don't know about you, but I don't, Nishi, I don't have anything else to say. I think I exhausted my windpipes and questions.
All right. No,
Yeah.
it's great.
This
Michael,
was
what about you?
This was very satisfying. I really enjoyed this.
Yeah, and I mean, I think what's great, Michael, is that not only do you have a lot of experience and you're obviously well versed in Lacanian theory, but like you don't have to like get into like, because we brought up earlier the aesthete of like the Lacanians. Like we really, besides ordinary psychosis, maybe a couple other lines, it's like was hardly like theory driven, because I think that's another thing it's easy to fall into. I'm guilty of it. I love theory. But, when it comes to the work, it's something where experience really matters most. And if you like just adopt all these like unquestioned techniques like the cut, and it becomes so like standardized or stereotypical, it's like the analyst just becomes another NPC. It's just like we're not doing anything new.
I mean, I belonged to a Lacanian group once upon a time that had a very rigid definition of what analysis was, and I was a much poorer practitioner for it. And I'm not saying, I went from the bad one to the good one. I am saying I reconsidered my own position and fantasy as an analyst.
I think Lacanian psychoanalysis should resist standardization absolutely. And it'll take our practice more into the real and less in these imaginary distractions. So, yeah, Michael, thank you so much for joining us here today to have this rich conversation. I just love what happens when you get 3 people passionate about psychoanalysis in a room together, even virtually. And you just get to explore that.
Yeah.
We should do an in-person cast. We should all meet up.
Yeah,
maybe around the linking seminar.
I tried to get Ellie to join today, but her feminine jouissance is just too much for the camera. So
it would be. We wouldn't know what to do. This was a pleasure. I want to do this again, though, sometime. Please, anytime.
No, we look forward to that.
Yeah, thank you, guys.
Until next time, everyone, stay tuned.
Peace.
Very soon, I hope. Bye.
Thank you for listening to this episode of Parletra. If you enjoyed this conversation, consider subscribing to our Substack at parletrapress.com, or follow us on YouTube and Instagram at Parletra Podcast to stay tuned for our next episode.